Why are you feeling all those negative feelings at a time that was supposed to be super positive and happy? A newborn, for most, is, after all, something to be happy about. Have you ever wondered about control? You know, your life has made this huge shift from being just you to take care of to another human being, a whole precious and very, very dependent life that you're now having to take care of. Do you ever feel that you have to be in control all the time? And is having to be in control unconsciously maybe affecting you? Maybe you're experiencing things like intrusive thoughts, and your OCD is getting worse, or it's all of a sudden appeared. Anxiety, maybe. You know, they're all about trying to regain or maintain control, or the negative feelings associated with potentially not being in control or losing it. So, you know, after all, how do you control a baby when they can't even tell you what they're feeling? Why are they crying? Why are they not feeding? Why are they not sleeping? You want the sense of control, but the fact is that there is no way, absolutely no way, that you can 100% control any situation, basically, but especially the one of your baby, because you can't ask them what's going on. You know, you are, after all, trying to control lots of other stuff that's going on the inside and also from the outside. So how could that ever work if you can't even control or even understand all the things that go on the inside? Now, OCD, intrusive thinking, it's all very much about trying to control from the outside what you're feeling from the inside. But if we were able to control what we were feeling on the inside, wouldn't it be easy to control it from the outside? Now, you may have to listen to that one again, or I'll try and repeat it for you. If we are able to control what we're feeling on the inside, then wouldn't it be easy to control from the outside? And what we do is we start to desperately try and control it from the outside. And aren't we getting ourselves all worked up because of that? We're getting angry, we're getting frustrated, we're getting desperate, all from the outside. And how is that going to affect things that are coming from the inside? Your OCD, your anxious thoughts, your feelings. Are you stuck in a negative and downward spiral because you can't seem to get control over this? And should we try to prioritize getting control over our thoughts, getting back control over situations and over our reactions to those thoughts and those situations? And I'll try and give you an example to sort of illustrate what I mean here. And it's hopefully one that you recognize. So, for example, and that's happened to me, so that's why I'm thinking of this exercise. For example, you're really scared that your baby may stop breathing in the middle of the night. And what you've done is you've tried to start to control it by checking your baby every few minutes. What I even did, I started waking them up just to be 100% sure that they were still alive. And it completely disrupted their sleeping patterns. But also yours, your sleeping patterns are completely disrupted. So is that the baby's, creating basically a long-term domino effect on your mental health and your baby's sleeping health. Maybe also your partner, maybe like mine, getting really upset with me because from his logical point of view, he just didn't understand why I kept doing this. Why, if I'm so tired, why am I not just going to sleep? Why am I waking up a perfectly happy sleeping baby? And you not sleeping is probably turning into exhaustion now. That happened to me for sure. And exhaustion turns into a mental health issue, or potentially could turn into a mental health issue. And it's all stuck in this negative spiral, that negative thinking, which started with you trying to control your baby's health. Now, by prioritizing gaining control over your mental health, you know, over the intrusive thoughts, that you're taking a first step into that, taking back control over your sleeping habits, also the baby sleeping patterns, and over the whole situation, by understanding that your thoughts the likelihood of getting control over them will increase. And by getting control over your thoughts, you can better control your actions from the outside. And this example, that would mean no longer on the outside, outside waking up your baby, because you understand that from the inside, your thoughts, they're not realistic. And now that you have control over your thoughts, you're able to see that and you're able to control the situation from the outside. And please be kind to yourself, because yes, you may be trying to control things in a way that is damaging your mental health, but it all started out of a place of love for your baby, wanting to have the best for them, wanting them to be healthy and happy, wanting to take good care of your child. So please don't forget to be compassionate towards yourself when trying to send this control into healthier patterns, because at the end of the day, you're doing a really hard, really brilliant, and really special job. I hope that helps. Take care.